Doctors in Kiambu County have issued a 21-day strike notice over delayed salaries, non-remittance of statutory deductions to the Social Health Authority (SHA), and the county government's failure to hire additional medical staff. Speaking at the KMPDU offices in Thika Town, the doctors accused the Kiambu County government of repeatedly delaying their pay, leaving many healthcare workers struggling financially. Dr. James Githinji, KMPDU Central Kenya branch chairperson, said the salary delays and failure to remit contributions to SHA have left doctors unable to access essential healthcare services themselves.
Those who seek their services under SHA, and we all know that all Kenyans are supposed to seek their services under SHA, were not able to access health care from 9th. And we have a good number of doctors that have illnesses that require to be covered. So you can imagine a doctor who is expected to be seeing another patient when they themselves are not even sure how they are going to be treated their own illnesses. Because of the suddenness of the low number of doctors that have been hired, a hospital like Thika Level 5, which used to have 17 MOs, medical officers, handling their patients, are crying with only 2 MOs doing the work that used to be done by 17. So you can imagine the burnout in those 2 doctors.
Basically, we're here to just tell the county government of Kiambu, to tell the people of Kiambu, and to tell the Kenyans at large that effective 26th May at midnight, the doctors of Kiambu will regrettably have to down their tools if the county government of Kiambu does not address the issues that we have outlined in our strike notice.